My name's Karen Brown, and I'm a principal investigator and co-director of the Rocky Mountain Research Evaluation and Commercialization Hub, or REACH, which is based at the University of Montana and, in short, is a bio-entrepreneurship hub dedicated to identifying biomedical research discoveries in colleges and universities across Montana, Alaska, Idaho, and Wyoming, and accelerating their translation into technologies that address unmet medical needs, particularly for needs like health disparities or high disease burden conditions that we see in rural and underserved populations in the region. So I'm super excited to be kicking off this Reach Ready informational series with Teddy Johnson. Teddy joined the healthcare community over 25 years ago after graduating from Stanford University's mechanical engineering program. Since then, he has served startup and Fortune 500 companies in research, design, clinical, marketing, and sales leadership roles, developing imaging, interventional, surgical, and pharmaceutical products. Along the way, Teddy earned his MBA from the University of Michigan's Ross Business School. And with hard work, good judgment, and a little luck, Teddy has celebrated 2 IPOs and 4 acquisitions, while earning numerous patents and commercializing dozens of new products worldwide. Along with his role as Director of Technology Development for the Institute of Translational Health Sciences, Teddy teaches in the STEM and Biomedical Regulatory Affairs Master of Science programs at the University of Washington and mentors startup CEOs in Seattle and the Silicon Valley. Welcome, Teddy.
Thank you very much.
Can you tell me a little bit more about the role that you play in supporting academic researchers as they work to commercialize their discoveries?
Yeah, the primary thing that I do is help people to recognize really the value of the work that they're doing. And just really at just a basic level. People are doing basic science, and it's really easy for scientists to get tied up in the science and not really think about the impact beyond whatever impact statement or score is going to be put on some application, right? But instead, what I'm thinking about is really based on my experience working with doctors in operating rooms and cath labs and hospitals all over the world, and just seeing all the sick people, right? And what we recognize is that all of these, scientific and engineering innovations have potential applications clinically. And my work is really to help people who are kind of coming up with these things on the base level, to help them to see what some of those applications might be. And for those that already have figured out what those applications could be, to help them see, like how to connect the dots to having something that they're working on be implemented in a clinical setting. And so there's a lot of kind of discussion about, business and all that sort of stuff, but it's really more about helping people to see that it's possible to turn something which seems to be kind of a foundational technological innovation or scientific discovery, see that it's possible to turn that into something. That's pretty much the work that I do.
Yeah, I really like that. I like that we're talking and starting off with kind of that transition that you're making, or maybe just a different way to view what you can do as a researcher. What would you say are some common challenges that researchers face when they're making that transition from, basic science or just, on the bench research to more of commercialization, getting into the marketplace? How do they see those challenges, and then how do they overcome them?
Mm-hmm. Yeah, first of all, there's a kind of a, who am I and what do I want to be? There's really kind of, I observe kind of a strong identity crisis in talking to people about what to do with their innovations. The other thing is that often there's a big cultural challenge. What we see in some academic centers, given that at ITHS we cover the whole Pacific Northwest region and Oregon. Some academic centers have a wonderful support for translation of science into, products and systems that can improve clinical practice. And others don't. In some other settings, there's very much more of an ivory tower, science is pure and it should never touch anything. But what I'm forcing people to do is to connect their kind of scientific work life with their real life, right? Like we all buy products. I'm going to wager that we all have phones that we carry around. There was a price tag and there's a whole lot of technology inside. And at some point, the scientists who came up with the technologies that are inside had to have those transferred over into a thing that we all think is something that's worth carrying around in our pocket and paying money for to have. And so bridging that cultural gap um, is a big part. And so then with that, then there's a whole lot of tools and supports.
Mhm.
Okay, I've come to this place where I think it is socially acceptable for me to make something into a product that might go out into the world. Okay, I've gotten past, any sort of concerns about how my peers might look at me as like, just trying to be in it for the money, right? A lot of people will say, "Oh, you're in it for the money." It's like, no, actually, I'm in it for the sick people, right? For me, it's very easy to make that case because I've spent 25 years hanging out with the sick people, right? And I think if you're to talk to any practicing clinician, they would say the same thing. Like the sick people need what you got. So once you've gotten past that, then we can introduce people to entrepreneurship training programs, which can be as simple as attending a webinar of people talking about their experiences having gone from bench to developing a product to starting to do some sort of early clinical work, right? It can be as simple as just watching, or it can be more involved, uh, getting to cases in which people are actually starting to talk to people who would be potential customers and understanding what formulation or what format a product might take that would extend from what they're doing in their lab.
I feel like a lot of researchers are really battling with that misconception that it's all about the money, or it makes them a sellout if they go to commercialization. And I think that's a part of what we'd like to address with this. And I think one of the pathways to do that is to kind of elucidate what that process looks like for researchers. So what would you say is the difference between the pathway of commercialization, or how that differs from traditional academic research?
Yeah, so I think it depends on the type of research. So the people who are working in research labs where there is some perhaps vaccine development or some drug development, um, and those labs are doing that development in conjunction with some sort of clinical study. It is very clear that there is an impact on patients and patients' lives, right? So, innovator of the year, Nora Dices, named through the School of Medicine here, her lab, like they literally make batches of vaccine for breast cancer. They make batches in the lab and then they go to the clinic, which is a floor away, and they inject it in the patient, right? Like there's no selling out there. They're trying to protect people from breast cancer, right? And so I think when people have those sorts of experiences where literally they made something that is helping someone and it's helping someone in a way that, at least half the population of the world would like to be helped, right? I
Mhm.
think it's a lot easier for people to understand the potential impact they can have when they've had exposure to those types of experiences. And I think the same is true even if you're getting into some digital health application. I am super excited about digital health because it means that people who maybe are far away from their treatment center can have some workup done at home before they fly somewhere or drive 6 hours, right? And then if they go have some major procedure done, instead of having to stay at the hospital for 2 weeks or 3 weeks through the early follow-up phases, they could go home and be monitored through these remote technologies and still know that they're totally safe and being watched over such that their treatment is going to go well, right? And that they will heal and recover. So these technologies are things, in the way I think about them, these are technologies that really make it possible for people to live their lives and have access to care that they've never had access to. And when we pull people off the bench, basically, pull things off the bench. That's what we're doing.
Yeah, and I think that there are a lot of researchers who are potentially working on something or, a couple steps behind, but potentially working on something that could really, really benefit patients, but they don't even really know it yet or aren't quite sure if that's the path that they want to take. My final question for you is, what advice would you give to a researcher who is unsure about whether or not they want to commercialize or if that's the right move for them?
Mhm. So first, I would say encourage them not to ask if they should commercialize.
Hmm.
Encourage them to ask if there's a patient who would benefit from this.
Yeah.
That's a very, very different question. I've worked at a lot of startups. Commercialization is a whole circus of activities. And it is a long journey fraught with many problems. It can go incredibly well, and it can just be just trauma, right? But if you're just thinking about, could I use what I have to help a patient? That sets you down the road. Think about it like riding a bus. You can get off at your stop. So there's a lot of people who love the basic science. They find a patient population that their science could benefit, and they start developing towards that. And then they bring on a partner who might take it the next stage. And that partner might be a large company that's going to license the technology. It might be a team that forms around the technology. And maybe the scientist is going to stay, as chief science officer and keep feeding the pipeline of that scientific development while they stay in their lab, right? But they've kicked off this process, they've built this team, or they've developed these partnerships because they asked the question, is there a patient I could benefit? And I think that makes it possible for people to start making those first steps and start making those exploratory, outreach calls, what have you, to get things out the door.
That made me think of one more question if you have time.
Sure.
Something that I've noticed, especially with our reach teams, is a lot of I think this is common in the academic setting. There's a lot of collaboration, there's a lot of discussing with others, getting expertise from others. And I think that we often are seeing projects come into the reach pipeline where maybe there's some loyalties there, or they really need to develop the project together to make it feel like it's a continuation of their research. So I think it would be important to get some insight into how you approach building teams or how you approach those types of partnerships when it comes to in a commercialization effort.
Yeah, I'm really glad you asked that question. Um, and I would think about it this way. People say, don't go into business with your family members, right? There are some, spousal partner teams that can do an amazing job. They are incredibly rare. More often than not, it is somebody has a great idea and can do great stuff. Somebody else wants to be involved. I see this all the time. And very early on, when I'm talking to teams, I'm getting them to figure out who should be involved. And the way I do it is I say, okay, don't think about this as yours or theirs or mine or ours, whatever. Think about the jobs that need to be done. We need to get this from point A to point B. We need to do this. We need to do this. We need to do this. And then you can say, who's the best person to do this, this, and this, right? And what you'll find is that there might be somebody on the team who does not match any of the jobs that need to be done. However, they still have a strong affinity for the project. And you're like, that's great. You can support us from the sidelines. But the real problem is they might say, well, I was in the lab or I was on the paper that got this thing going. Yes, that's true. And the question ends up being, do you want to do this for the next year, 3 years, 5 years, 10 years? Or do you just want to be involved? Right? Is it okay if we just send you an update? Or are you actually going to show up and do some work? And so when you challenge people with the, are you actually going to do some work? And here's the work that needs to be done, it makes that conversation much easier because then you can say it's okay to be relegated to a you're the biggest fan and yes you were on the paper and you were an early innovator, great, but those people really need to not be in the way because it's like having people in a boat. Anybody who's not rowing is just extra weight and it slows things down. And usually these efforts are totally on the side, right? Like it's not somebody's main job, it's not within the time frames, it's probably it might not be funded. So if you have some people who are just kind of dead weight, it's awful. It crushes the whole effort. They could support the program much more by supporting the program, promoting the program, but not being involved in one of those jobs because they're not going to do that job anyway. And so I think it's really important to be realistic about that. And really, in that way, foster the development of whatever the product is.
Fantastic. Thank you, Teddy Johnson.
Yeah, thanks for having me.